There are lots of fears in a woman's life about the thought of a cute infant who are safe in mother's tummy, which sets at rest all qualms by not giving an instinct of less care and caution for the purposes of watching its movements with gaiety. The very first occurrence of pregnancy brings about the feeling of the tiny creature, which is a great marker of pregnancy, and during such movements, you also encounter dynamic kicks when you are being hit by tiny feet, as well as getting touched by your own child's movements. Many women, during the course of your first pregnancy, bring about sensational as a flurry of moving actions, and scientifically, during the first pregnancy movements are first felt during the times of 20 weeks hence. Baby movements later pregnancies. Whenever one is aware of various signs, the first fetal movements get quickened, and it is felt just about 15 to 18 weeks. Whenever the movements go stronger from the baby's various flurry of activities impact, the movements becomes stronger as well as clear. While the weeks elapse, you will have a tendency that your baby has more activity with an increase in its movements. From 20 to 24 weeks you will a tendency to become more active with more active baby. After the advent of 10 weeks thereafter, the baby will become very busy amidst lots of kicking and tumbling activities. After 24 to 28 weeks, hiccups could also become another activity done by a little child, and you may never feel the movements of jerks. At this juncture, the amniotic sac contains a lot of fluid which allows free movements of the baby. Sudden emergence of sounds should also be noted during the course of this phase. After about 32 weeks, baby's active movements as well as hereafter you will be observing heightened movements, basing the fact that the baby is getting more big and stronger. Baby movements after around 36 weeks, the baby would be taking final positions by facing its head on a downward direction. Whenever you are encountering the first pregnancy, the firm muscles of your fetus as well as abdomen would make the formation of a comfortable pillow. After 9 months, the birth of a newborn baby occurs when it greets everybody by its arrival within the circle of family and friends. To conclude, baby movements during pregnancy bring about a lot of care and caution in watching the movements of the baby without causing impairment on the functioning of the human body, including the baby. If you are among those women who are unable to get pregnant through natural ways, then you may have heard about the term assisted reproductive technologies. It refers to a range of methods which are applied for getting a woman pregnant from completely or partly artificial means. Use of ART may also be required for fertile couples for a range of genetic disorders. This term is wide, and it also involves any such reproductive method which includes a third person. For instance, the person who donates his sperm is said to be the third party. Before assisted reproductive technologies or ART are applied on an individual, various investigations are done for finding out the main cause of infertility. Several tests are conducted for both the husband and wife. Based on these tests, there are 3 categories of infertile couples. First, either husband or wife has some particular fertility defect. Second, more than one defect is spotted in either husband or wife or both. Third, neither wife nor husband has any defect. Such a condition is named unexplained infertility. Assisted reproductive technologies. Different procedures are included in ART. On the basis of the condition, requirements and consent of the patients, one of the ART procedures are applied on them. ART procedures include intracytoplasmic sperm injection, ICSI, in vitro fertilization and embryo transfer, IVF Eastern Time, and gamete intrafallopian transfer. In ICSI, a sperm is injected into an egg with a fine needle. This procedure is performed under a microscope. IVF Eastern Time procedure is done for the people who have endometriosis, tubal disease, uterine problems, immunological factors, etc. In GIFT, sperm of the male and eggs of female are washed and put in the fallopian tube of the woman with the help of a catheter. Several risks are involved in artificial reproductive technologies. Doctors inform about these risks in advance to the couples. Preterm birth, ectopic pregnancy, multiple gestation, impulsive abortion and ovarian hyperstimulation syndrome are some of the risks which are associated with ART procedures. The child which takes birth through ART procedures also faces risk of several problems. Consent of both the partners is important before carrying out ART procedures.